Welcome back to my channel. My name is Dr. Anwar Youssef Dunbar, and this is Big Discussions 76, Science and Technology. First of all, please like this video, please share it, and please subscribe to my channel. If you want to make a donation to the channel, that information is below in the description box. And also, please consider joining the Big Words LLC Newsletter, as I am a writer, in addition to being a YouTube content creator with 2 blogs and a book project on the way. Well, everyone, I wanted to come back and make a short video on the principle of pharmacodynamics. Before I jump into that, thank you to everyone who has supported my recent content. I've conducted some very educational and fun interviews, and there are more on the way. But this video, this short pre-record, is going to be about the principle of pharmacodynamics, and that is a key principle in the field of pharmacology, which is the field I have my training in. A couple of months ago, after the Supreme Court rendered its controversial decision on Roe versus Wade, this is not a political video. So if you're thinking that's what this is, and just mentioning that case turns your stomach, this is about science. So after that decision, I conducted a stream talking about the science behind that decision. And one of the drugs I talked about in terms of oral contraception, I talked about the pill RU486. That is a pill used as an oral contraceptive. In that stream, I talked about how the pill works, how the active ingredient works. It works through inhibition, or maybe I think blockading or antagonizing the progesterone receptor. It acts as an antagonist for the progesterone receptor, and that leads to contraception. But after conducting that stream, I realized that I described pharmacodynamics, but I didn't actually say this is an example of pharmacodynamics. Okay, so what pharmacodynamics is it's simply the mechanism of the drug. It's how the drug works in the body, at the tissue level, and at the cellular level. So, moving on from RU486. About a week and a half ago, Dr. Dunbar had to go to the dentist to get a filling changed out. So it turns out that many years ago, as a young person, I had a cavity, and in those times, they were using mercury and silver for fillings, which they're not doing now because that can be toxic to the person whose mouth they're putting it in. But years later, my current dentist realized that filling was cracked, and I had to get a new one. So I went back to the dentist. It was a quick procedure, but it involved them, getting into my mouth with tools and picks and drills and all kinds of things. I don't enjoy going to the dentist. But they had to numb my mouth. So he stuck a needle in the top portion of my mouth, in my gum, and they numbed the top of my mouth. Any of you who have gone to the dentist and had that happen, you know that your mouth starts feeling kind of weird, and it's not functioning. It's not functioning, and it doesn't even feel the way it's supposed to feel because it's numb. Well, afterwards, once the procedure was finished, I asked the assistant or technician or hygienist who helped out my dentist, what did you guys give me? And she said lidocaine. So lidocaine is the classic, well, I'll call it the classic dental anesthetic. So I'm going to describe what lidocaine is and how it does what it does. Now, this quick description is via a very, very simple Google search. You can look this up yourself. Lidocaine, also known as Lidocaine, and sold under the brand name Xylocaine, among others, is a local anesthetic of the amino amide type. It is also used to treat ventricular tachycardia. When used for local anesthesia or in nerve blocks, lidocaine typically begins working within several minutes. Yep, it did. And I'm sorry, and lasts for half an hour to 3 hours. Lidocaine mixtures may also be applied directly to the skin or mucous membranes to numb the area. It is often used mixed with a small amount of adrenaline, also known as epinephrine, the technician did say that, to prolong its local effects and to decrease bleeding. In terms of its mechanism of action, lidocaine alters signal conduction in neurons by prolonging the inactivation of the fast voltage gated sodium channels in the neuronal cell membranes responsible for action potential propagation. With sufficient blockage, the voltage gated sodium channels will not open and an action potential will not be generated. Careful titration allows for a high degree of selectivity in the blockage of sensory neurons, whereas higher concentrations also affect other types of neurons. The same principle applies for this drug's action in the heart. Blocking sodium channels in the conduction system, as well as the muscle cells of the heart, raises the depolarization threshold, making the heart less likely to initiate or conduct early action potentials that may cause an arrhythmia. So just briefly, many of the processes in our bodies rely upon action potentials and electrical currents. I'm not going to get into that. I'm not going to get very deep into that. There are whole textbooks and whole courses on that principle right there, and I took some. But basically, you're shutting down voltage-gated sodium channels, and once you shut those down, in this instance, in the patient's mouth, you're turning off the pain perception. It's not that they're not doing anything. You know, when the dentist gets in there and they drill and they take out the old filling, and when they do whatever they do, when they do whatever it is they have to do in your mouth, there's activity in there. There are materials being taken out. There are materials being put back in, and all of that will be painful if they don't numb your mouth. So they have to numb your mouth. So that's what that does, and that's why they use it. So, and that's an example of pharmacodynamics. So as I was sitting in the dentist's chair a week and a half ago, undergoing this procedure, I was thinking, okay, this is a nice jumping off point. This is a nice example to describe for viewers to communicate the principle of pharmacodynamics. So that's pharmacodynamics. It's how the drug works. It's the mechanism. It's what the drug does. So let me know if you have any questions or comments below in the comments section. Please like, share, and subscribe if you want to make a donation to the channel. That information is below in the description box. And also, please consider joining the Big Words LLC Newsletter. And with that, I will stop this video. And as always, remember that your attitude determines your altitude. Take care, and I will talk to you the next time. Bye-bye.